Welcome to Slocum Center for Orthopedics and Sports Medicine. My name is Dr. Brian Jewett, and I specialize in total joint replacements of the hip and knee. In this video, we will be discussing when to consider joint replacement surgery. Most patients that come to see me are suffering from arthritis of either the hip or knee. Arthritis is a disease that slowly over years causes wear and tear of the cartilage in the joint that leads to pain and deformity in either the hip or the knee. Arthritis can be caused from trauma, years of wear and tear, genetic predisposition from bad cartilage, or the way the bones either in the hip or the knee form together in childhood, or even inflammatory metabolic problems like rheumatoid arthritis. Whatever the underlying cause, the eventuality is having a joint where the bone is rubbing on the bone, which leads to pain and deformity. And it's when it gets to that severe point that we should consider hip or knee replacement surgery. When your hip or knee begins to ache, typically patients are savvy enough that they can manage it with ice or rest, activity modification, or even anti-inflammatory medicines. But when that pain in either the hip or knee begins to affect your daily living activities, going up and down stairs, driving a car, sleeping through the night, that's the time to come see us to talk more seriously about what other options are available to help treat the ailment in your joint. Not all arthritis has to be treated with joint replacement surgery. There are other non-surgical methods to help relieve the pain in your joint. Things like medication, supplements, anti-inflammatory medicines are good for long-term use to help treat arthritis before it gets too severe. There are injections into the joints of either steroid or lubricating medicines, and specifically in the knee, that can help ease the pain. Braces sometimes can be useful to offload pressure in a joint to relieve pain. Physical therapy and muscle strengthening can help strengthen the muscles around the joint and protect the joint. And obvious things like weight loss and activity modifications, reducing the stress on the joint to ease the pain, are common recommendations that we make to help prevent knee or hip replacement surgery. Patients should consider joint replacement surgery when the pain in that joint gets to a point where it is affecting every activity of your daily living. Things like sleeping, driving a car, going up and down stairs. When it gets severe that it's affecting everything in your life, that's the time to consider hip or knee replacement surgery. After successful joint replacement of the hip and knee, we expect patients to get back to a full active lifestyle. Things like doubles tennis, downhill skiing, golfing, hiking, fishing. But you should make some modification in your life to protect the hip or knee. Things like golfing without carrying your golf clubs, playing doubles tennis, not singles, and if you choose to ski, staying out of the moguls. Things of that nature to help protect your joint and make it last a long time.